Can you tell us a little bit about some of the practical experiences you've had, the starting points, the key areas or focuses or actions that you think can start to move the dial?
Yeah, I've actually written a implementation guide for psychological health and safety that resides on our website. So I would invite your listeners to download that. But the first thing that you need to get right is leadership commitment. And when we say leadership commitment for psychological health and safety, we're not saying they're giving you, a few $1,000s a year to get your cupcakes and get a keynote speaker in for Are You OK Day and pay for your EAP and that sort of thing. Or maybe even get up publicly and talk about a lived experience of poor mental health and mental illness.
Yeah.
That's not leadership commitment. Leadership commitment is that they've identified that psychosocial hazards pose a risk, and therefore they reside in your risk register as a company. It's not just the physical risks, but you're covering work-related stress, you're covering things like bullying, harassment, and other key psychosocial hazards.
Yeah.
The other way that they demonstrate leadership commitment is that they've ingrained it into policy and governance. You're not going to get the time or resources required as a professional to do psychological health and safety right unless there's policy that sits behind it. If you're, and I'm not one for, like Carla, I'm not one for duplication. I think if you can kind of embed, psychological health and safety into existing governance or policies or procedures, then that's better. So just as simple as adding, we recognize that psychosocial health and safety is both a individual and an employer responsibility.
Yeah.
And so therefore we are going to commit to educating employees, and we're going to commit to doing risk management of psychosocial hazards.
Sure.
That's really what Maria Boland recommended in her review of the WHS Act. It was, let's not, come up with a whole new act for psychological health and safety at work. It's let's just add the term psychological health a little bit more into, the current act.
Yep.
So once you've got it at a policy governance level and it's in your risk register, you'll find it's far more easy when you want to work in this space to get time, budget, and other resources required to do it well. But I find, without that real leadership support characterized by those things, what you'll find is that you just get the token, oh yeah, you can do a lunch and learn here, or you can do that. It's not strategic. It's not systemic. So